Hello, my name is Brittney Wappes, and I'm with the UT Health Science Center at San Antonio, Department of Periodontics, Dental Hygiene Division. Today we're going to be going over denture and partial care. Some objectives that we're going to be discussing are proper denture care with the maintenance, cleaning, when your dentures are not in use, discuss infectious diseases caused by improper denture care, and proper application of the dentures. Before we get started, I want to emphasize that it's important to be thoroughly washing your hands and then when assisting with your patients to be properly gloved. You want to make sure to be handling the dentures with great care. Standing over a sink or having a towel underneath you is great to avoid any dropping or breaking of the dentures or partials. You want to be sure that you are brushing the dentures or partials every day, especially after meals, to remove any food debris, plaque, and it helps to prevent staining. You want to be using a soft bristle toothbrush, just like you would with your natural teeth, to help with brushing the dentures or the partial. When brushing your dentures, a regular toothbrush is acceptable. Just make sure that it contains soft bristles. However, a better option is the actual denture toothbrush. It gives you more options with having two different sides with shapes to get a better cleaning into the crevices of your dentures. And it does contain more fibers than a regular toothbrush. When cleaning the dentures or your partial, you want to steer away from household cleaners or toothpaste to where they can be too abrasive. You do not want to use bleach to where it can whiten the pink portion of your dentures. And you want to avoid any Listerine or alcoholic solutions. It can cause drying out and cracking of the dentures. You do want to use denture paste and gel or a mild non-toxic cleaning solutions or professional over-the-counter denture solutions. And then, of course, whenever visiting your dental office, having them clean it in the ultrasonic cleaners. When your dentures are not in use, you want to make sure that they are kept in a moist environment so they do not dry out or lose shape. You want to be careful whenever placing the denture or the partial in a denture solution where the denture or the partial has any metal attachments. This may cause tarnish whenever placed in a soaking solution, so you want to be sure to ask your dentist for the best method. You never want to soak your dentures in any hot water to where this could warp the dentures or the partials. Be sure to be changing out the denture solution or partial solution or water to avoid any bacterial buildup. Now we're going to go into infectious diseases caused by improper denture care. The first is Denture-Induced Fibrous Hyperplasia, also known as Ebulis fissuratum. It's caused by ill-fitting dentures, and it's found along the gum ridge of the maxillary or lower mandibular arches. In this picture, you will see it's more of a severe case of having elongated folds to where surgical excision would be needed and then reconstruction of the dentures. Another infectious disease is the inflammatory papillary hyperplasia of the palate. It's a form of denture stomatitis. It's associated with wearing dentures 24 hours a day, 7 days a week. So it is important to be taking out the dentures a couple hours a day or overnight. You may see multiple red papillary projections on the palate, like shown here in the picture, which can be treated with an antifungal medication, or your dentist may prescribe a nystatin oral rinse. For denture application, you want to make sure that the dentures are clean and moist before applying them into the mouth. Proper amount of adhesive is very important. If the denture is causing any irritation, you can apply a lubricant to help with the application. How to know when the dentures are not fitting properly. If you notice that your resident has lost more than 10 pounds, or they're having trouble eating, or the dentures are not staying in place, it is important for them to go see their dentist to have their dentures evaluated. For appropriate denture adhesive, shown in the pictures, it's showing the proper amount of adhesive to be applying to the dentures when placing them into the mouth. It is important to have the dentures evaluated yearly by a dentist for proper fitting. And always make sure to take care of those dentures. Thank you for your time.